report from the CDC shows adults 65 years and older have accounted for nearly 2/3 of COVID-19 hospitalizations in the U.S. this year, saying this new data shows there is a continued public health threat. Joining us now to talk about this and some other health topics today is Dr. Bill Hartman, clinical trialist at UW Health. Let's start with this. Are you surprised that those 65 plus, the most vulnerable population here in the U.S., are those being hospitalized with COVID?
Well, since COVID started, just over 3 years ago, this has been the population that's been most at risk, the over 65 people, and even worse for the people who are over 85 years old. And so we really have to do everything we can to make sure that we find the right protection for these groups of people so they don't get sick, so they don't get hospitalized, and so they don't die from COVID.
I feel like COVID cases are certainly ticking up. I mean, the numbers prove it. But at this point, I feel like, every person, especially in the newsroom, knows somebody who has had it this kind of new cold and flu season. Are you surprised that the numbers are going up at this point? And when it comes to severity, what are you seeing? Are they pretty mild cases, or have you seen some severe ones?
Well, we certainly are seeing some severe cases. There's still people that are hospitalized, still people going in the ICUs, and still people dying from COVID. That being said, the majority of us have developed immunity over these last several years, whether it's through infection or through vaccination, which gives us the ability to fight off the virus much better than we did before. And so the fact that we're seeing a lot of cases and a lot of people have COVID, we're seeing a lot of people recovering from COVID too.
And that is good news. We're hoping if the cases do go up, we're hoping the recovery is up as well. Let's totally switch gears here and talk about some drugs that have been used for weight loss in the past couple of years and have really gotten some traction, especially when it comes to social media influencers. Ozempic and Wegovy are two of the most common types of drugs. And now there's some new warnings coming out about those who are using these drugs for weight loss, right?
Right. And so Wegovy and Ozempic and the other drugs known as these GLP-1 agonists, they are very good at helping people lose weight. They're very good for the treatment of diabetes, but they also come with some serious effects like paralyzing someone's stomach by causing bowel obstructions and an inflammation of the pancreas called pancreatitis. It's still pretty rare, these effects, but about 1% of the people that are using these medicines will experience these deleterious effects.
Is it people who are misusing the medications that are seeing these adverse effects?
It's hard to say. We don't know exactly which people are going to be affected by these adverse effects, but it's certainly something that we have to keep an eye on, and something that we know, especially the stomach paralysis part of it, can cause real problems to people while they're taking these medicines.
Moral of the story, there is no magic wand when it comes to this sort of stuff. Dr. Hartman, we always appreciate it. Thank you.